Good morning. My presentation title is AI-based chest X-ray screening for tuberculosis in Myanmar. This proposal explores how deep learning image analysis can enhance TB screening capacity in low resource and high burden setting like Myanmar. Specifically, I examined the diagnostic accuracy, workflow efficiency, and ethical feasibility of implementing these AI algorithm in tertiary hospitals in Myanmar under the National Tuberculosis Program. The ultimate goal is to provide evidence for responsible AI integration that support the country progress toward WHO and tuberculosis 2030 target. So tuberculosis remain one of the most world leading infectious killer. According to the WHO 2024 data, 10.8 million people developed TB last year, and 1.3 million people died. And the Southeast Asian regions account for nearly half of the global cases, with India, Indonesia, Bangladesh, Myanmar contributing the majority. In Myanmar, it is estimated that incidence is above 500 per 100,000 populations, and which is one of the highest in the region. And there are radiologist shortage, limited laboratory access, and then uneven infrastructures lead to diagnosis delay that can last several weeks, increasing transmission and mortality. So these bottlenecks highlight the urgent need of scalable technology-assisted diagnostic support. Chest X-ray screening is essential to TB detection, and yet interpretation depend heavily on human expertise, such as a radiologist. So deep learning algorithms such as CAD for DB and QXR have demonstrated diagnostic accuracy comparable to expert radiologists with sensitivities between 70 to 85% and specificity about 90%. So in 2021, a pet pilot project in Myanmar using QXR detected 21 additional TB cases within 3 months, and it reduced reporting time from days, which used to be days, to minutes. So the proposed study builds on the evidence, applying the consolidated framework for implementing research to assess technical, organizational, and behavioral factors that influence the adoption. So implementation will also align with the WHO ethics and governance of AI for health, which is published in 2021. It's a principle of fairness, transparency, and human oversight. Successful AI integration depends on the digital readiness. So Myanmar, according to the Myanmar uh, WHO digital index, is 41.3 out of 100, reflecting a partial maturity. And policy and government mechanism exists through national digital health strategy and tertiary hospitals such as Yangon General Hospitals already on the picture achieving and communication systems. And technology enables, despite these barriers, the growing e-health infrastructures and a strong TB program provide a promising foundation for a control AI project. So the project U2 phase mix method design. For the phase one is a retrospective evaluation of study for Yangon General Hospital, analyzing around 25,000 de-identified chest X-ray collected between 2020 to 2024 to evaluate the QXR diagnostic performance against the microbiological reference standard, which has been currently being using. And for the phase two is prospective before and after study at Ansan Tuberculosis Hospital, involving about 2,000 patient presumptive TB assess real world workflow efficiency. And the workflow integration integrate AI with existing systems where chest X-ray is uploaded and to AI triage and then radiologist verifications and report to the national TB database. Data will remain encrypted on the local server, and clinical clinician will receive structured AI literacy training monthly feedbacks to reinforce safety and trust. For analysis and expected outcomes, performance will be measured using sensitivity, specificity, and predictive values, and ROC curve and Magnemer test, comparing the pair results between AI and the radiologist. Operational outcomes include time to report, radiologist throughput, and treatment initiation rates. We anticipate that QXR will achieve at least 85% sensitivity and specificity, reduce turnaround time to less than an hour, and increase radiologist productivity by 40%. So subgroup analysis by age, gender, ethnicity, and HIV status will ensure fairness and detected algorithm bias. And based on the regional experience from India and Vietnam, these efficiency gain could shorten the diagnosis delay by 50 to 60% and raise case detection by 15 to 20%. So such outcomes would strengthen the cost effectiveness and accelerate the treatment initiation between the TB programs. For human factor ethics and sustainability, responsible AI deployment is very important, which include the ethic, human factors, and sustainability. So ethical government is central to this proposal. To the proposal, all patient data will be anonymized, stored securely, and used only with informed consent. The mode of follow-up a human in loop structure. AI provide triage, suggestion, but radiologists will be the one making the final diagnostic decision. And regular reflective debrief and training sessions will address automation bias and over reliance on an AI output. The dataset will include image representing Myanmar majority groups to monitor algorithmic fairness. Long-term sustainability will rely on the local building and operate open collaborations with QE AI and the Ministry of Health and the integration with the existing e-health policies. These measures collectively ensure that the AI deployment remain equitable, transparent, and culturally acceptable. So, for conclusion, this proposal represents ethically grounded evidence based to approach to implementing an AI-assisted TB screening in Myanmar by combining the retrospective evaluation with the prospect workflow analysis. It generates both scientific and operational evidence for a safety development. And this anticipated benefits include faster diagnosis, improved access, reduced workflow for radiologists while maintaining the human oversight. So challenges such as inconsistent connectivity, image quality variations, and model drift will be mitigated through offline functionality, continuous recalibrations, and clinician engagement. Further research should explore health economic modeling, policy frameworks, and for AI governments, and we will pilot expansion. Ultimately, this project demonstrates that AI can argument, not replace human judgment, supporting Myanmar National Strategic Plan for Tuberculosis and WHO and Tuberculosis 2030 vision. Thank you very much.